This is the first lecture in a two-part series covering the lymphatic system. Lymphatics are located all over the body with three exceptions. You do not find them in the CNS, the central nervous system, in the bones, or in the teeth. There are several parts to the lymphatic system. The first we'll cover is lymph. Lymph is interstitial fluid. It's a liquid part of the lymphatic system. It has the same composition as blood plasma. Every day, we lose about 3 liters of lymph from the circulatory system. Another important component of the lymphatic system is the lymphatic vessels, which carry the lymph or the liquid. On the right is a diagram of the lymphatic vessel, and on the left is a microscopic slide. There are 2 main lymphatics that drain all of the body. They are the right lymphatic duct, which drains the upper right quadrant into the right subclavian vein, and the thoracic duct, which is the largest, and drains the other 3 quadrants into the left subclavian vein. The lymphatic vessels are a one-way system of vessels. The smallest lymph vessel is called a lymph capillary, and unlike blood capillaries, they end blindly in tissues and are very porous. If you put this slide in slide presentation mode, you can see how the lymph capillary works. Here are the parts of the lymphatic system. You can see the lymphatic vessel carrying the lymph and the lymph capillaries that dump into the lymphatic vessel. One other thing in this diagram is the lymphatic valve, and we're going to talk about that in just a minute. When we covered the circulatory system, you saw that more fluid leaves the arterial end of the capillary than comes back at the venual end. It is important that we get this fluid back to the circulatory system. The most important job of the lymphatic system is to return fluid to the cardiovascular system. But the problem is lymph in the lymphatic system is under very low pressure. So how can we move the lymph back to the circulatory system under these circumstances? In a low-pressure system, how do we get lymph back into the lymphatic system? There are 3 things that help with this: skeletal muscle movement, the ventilation cycle or the breathing cycle, and one-way valves. So how do the skeletal muscles and ventilation help to move lymph back into lymph capillaries? And the reason they do is because as they move, they put pressure on the lymph capillaries, and this helps to move lymph into the lymphatic system. It's a mechanical effect. I mentioned one-way valves a little earlier. One-way valves prevent the backflow of lymph in the lymphatic system. You can see this in the microscope slide, and you'll also be looking at the one-way valve in the laboratory. Besides returning fluid to the circulatory system, the lymphatic system has other important jobs. They are transporting fats from the gastrointestinal tract to the blood and protecting us from microorganisms and fighting disease. Lymphoid tissues and lymphatic organs both contain lymphocytes and phagocytic cells. Phagocytic means cell-eating, and both of these help to fight disease. Lymphoid tissues are located in many places. They line the GI tract, the respiratory tract, the urinary tract, and the reproductive tract. You also can find lymphoid tissues in tonsils, lymph nodes, and the appendix. There are 3 pairs of tonsils: the palatine tonsils, which are the largest and the most often infected. They are located posteriorly and on either side of the oral cavity. The lingual tonsils are tonsils at the base of the tongue. Lingual refers to the tongue. And the pharyngeal tonsils, which are also known as the adenoids, are on the posterior wall of the nasopharynx. The tonsil is attached by a small stalk that creates a crypt-like area, and the purpose of this crypt is to trap and destroy bacteria. This builds up a memory for lifetime protection. This is a slide of the tonsil, labeled lymphatic tissue. You can see how it forms a crypt. Sometimes these tonsillar crypts become infected. You can see the pus in these crypts in the slide on the right. Lymph nodes produce beta lymphocytes, also known as B cells. Beta lymphocytes, or B cells, are a type of white blood cell that makes antibodies. Beta lymphocytes are part of the immune system and develop from stem cells in the bone marrow. The beta lymphocytes produce antibodies that identify and destroy infecting agents. They also cleanse lymph before it re-enters the blood. They are found along larger lymphatics. Hopefully in the video you were able to see the location of lymph nodes in the body. Lymph nodes are most numerous in the groin, the axilla, which is under the arm, in the neck, in the abdomen along the aorta, and in the thorax along the mediastinum. Here is a diagram of a lymph node. You'll be looking at lymph nodes in the lab as well. Be sure you know where the medulla is located, the cortex, the capsule, the trabeculum, the artery and vein, and the efferent and afferent lymphatics. These are microscopic slides of the lymph node cortex. Inside the cortex, you'll see follicles, and in the slide on the left, follicle is labeled F. Be sure you can recognize the follicle and know what it does. Again, this slide shows swollen lymph nodes. Remember, non-painful nodes can indicate cancer. Usually a painful node indicates infection. Let's look next at the lymphatic organs, which include the spleen and the thymus. The spleen is the largest lymphatic organ. It's indicated by the green arrow on the right. The spleen has a number of different functions, including removing old, worn-out red blood cells, producing B cells, storing red blood cells and releasing them under stress, storing platelets, and in infants, it produces red blood cells. These are pictures of the spleen. The thymus is another and smaller lymphatic organ. It is located posterior to the sternum, and it's part of the mediastinum. The mediastinum is the area between the two lungs. In children, the thymus is large, but after puberty, it atrophies or becomes much smaller. In adults, the lymphatic tissue is replaced by fat and connective tissue. The function of the thymus is to cause T lymphocytes to become mature, or what's also known as immunocompetent. Let's look at two diseases of the lymphatics, elephantiasis and Hodgkin's lymphoma. Elephantiasis does not really occur in this area of the world, but it's a very interesting disease. Elephantiasis refers to a parasitic infection that causes extreme swelling, usually in the arms and legs. The disease is caused by the filarial worm, which is transmitted from human to human through the female mosquito bite. The parasite grows into an adult worm that lives in the lymphatic system of humans. The treatment for this disease is drug therapy. Take a look at some of the following pictures of individuals with elephantiasis. Wucheria bancrofti, or W. bancrofti, is the parasitic worm that causes elephantiasis. You can see the swollen leg and foot of someone with elephantiasis. Again, these slides show people infected with elephantiasis. Remember that most often, this affects the legs. Hodgkin's lymphoma is a malignancy of lymph nodes. The nodes are swollen but non-painful. They're located most often in the neck, under the arm, or in the groin. Fatigue is common, weight loss is common, and the person has a persistent fever. Often there are night sweats. The treatment for Hodgkin's lymphoma is radiation. The prognosis, or the likely course of the disease, is there's a high cure rate. On the right, the lymph nodes of someone with Hodgkin's lymphoma are evident. Sometimes these soft tissue masses can push against the trachea and cause tracheal deviation. You can see this in the X-ray on the left.